Good. So welcome everybody, and today we're going to talk a little bit about Lyme disease, and we're going to talk about Lyme specifically, but I really want to put it in the context of infection. So even though we're going to talk about Lyme specifically, this really can apply to any kind of persistent infection because a lot of the underlying immune mechanisms that happen with Lyme also happen with other critters. So just kind of keep that in mind as we're going through our presentation today. So just some background information on Lyme disease. What is it? So basically it's a bacterial infection that's caused by a specific kind of bacteria called a spirochete. And the name of it's called Borrelia burgdorferi. That's where we first discovered it. And you primarily get this through a bite of a tick. And there are very specific ticks that I'll talk about in just a minute that we know transmit Lyme. The spirochete, though, is a cousin of things like syphilis, and there's another one called leptospira. And although they're completely different organisms and they behave in different ways, they're in the same kind of family. We first discovered Lyme disease really back in the 1970s, and for those who don't know, it's actually named after Lyme, Connecticut. I practiced in Connecticut for almost 20 years. I was about 30 minutes down the road from Lyme. It's a beautiful little town, but back in the late 70s, there was a group of children that started getting what was diagnosed as juvenile rheumatoid arthritis, which is a somewhat rare condition, and yet the percentage of kids who had it was abnormally high for that area. So they started investigating and trying to figure out why. And if you read about the history of it, they always talk about the kids. What they don't talk about is that there were actually a lot of adults that were having similar symptoms. So these different arthritides were going on between kids and adults. No one could really explain it. And it actually took them several years to try and figure out what was causing it. So there was a researcher at the Rocky Mountain Spotted Fever Clinic in Colorado, a doctor named Willy Burgdorfer, who was a research scientist, and they thought this was some type of rickettsia. Rickettsia is the disease or the organism that causes Rocky Mountain Spotted Fever. So they thought it was a rickettsia, so they sent it off to Dr. Burgdorfer. He started investigating and found that it wasn't a rickettsia at all. It was actually a spirochete. It was a new spirochete that hadn't been discovered. So the rules are when you find the organism, you get to name it after yourself. Hence the name is Borrelia burgdorferi after Willy Burgdorfer. What we now know is that Borrelia is a very complex organism, and there's several strains of this organism. So Borrelia burgdorferi was really the first one we discovered. We now know there's at least 100 strains of Borrelia in the United States and more than 300 strains worldwide. Keep that little factoid in your mind, because as we start going through and talking about Lyme testing, that becomes important, because the testing we do looks for one. So the reason we miss Lyme so much is that we're probably not looking for the right organism. California, my now new home state, I relocated to California last year full-time, is now the 5th fastest growing state for Lyme. Most of the Lyme cases still come from the Northeast, New England, and the Central Midwest, so Minnesota, Wisconsin, and so forth. However, it has now been reported in all 50 states. That includes Hawaii and Alaska. So, you know, this concept, well, we live in a state where there's no Lyme, and if you think you have Lyme and you live in Arizona or New Mexico or wherever, and your doctor says, oh no, we don't have Lyme in the state, I think Dr. Amen said earlier, well, you gotta learn how to read, because, if you look at the data, the information's out there. So we know that Lyme's in all 50 states, and actually it's on every continent in the world except Antarctica, as far as we know. It's been reported in Africa, Asia, and so forth. So it's really a worldwide epidemic. We report about 300,000 new cases. That's new cases, that's not total. So you can imagine, do the math, 300,000 new cases every year in the United States alone. And about 65,000 cases in Europe. We know it's underreported. We don't know what the true number is. Is it 500,000? Is it 1 million? We don't know. What we do know is it's epidemic, and it's far more common than people think. So this is just a picture of the little critter that can transmit Lyme. This is called the Ixodes tick. There's Ixodes pacific, which is primarily on the west coast, and Ixodes scapularis, which is mostly on the east coast and the central Midwest. There are other species of Ixodes, and there are other ticks that may transmit Lyme. However, this tick accounts for the vast majority of Lyme cases. I think if you live in an area that's Lyme endemic, it's good to know what these ticks look like. I mean, I lived in Louisville, Kentucky for several years, and my brother and I used to pick ticks off ourselves, but they were dog ticks or wood ticks. They're a rounder body, harder shell. As far as we know, they don't transmit Lyme. So if you live in an endemic area, just go on Google and look up pictures of ticks so you can kind of get familiar with what they look like. So Lyme is the #1 spreading vector-borne disease in the world. Borrelia can infect any tissue organ system. As a result of that, you could get numerous symptoms. There's upwards of 100 or more different symptoms associated with Lyme. We actually call Lyme the Great Imitator, the Great Mimic, for that reason, is that it looks like a lot of other different conditions. Lyme is also an organism that has this unusual life cycle. It's actually very slow growing. If you look at most bacteria in your body, like what causes a sinus infection or bronchial infection, most bacteria replicate every 20 minutes. Lyme, if you look at the research, replicates every 1 to 16 days. That's actually incredibly slow. The only organism I know that's slower than that is tuberculosis. And if you've ever heard anyone who gets TB, they go on an antibiotic regimen of 3 antibiotics for a year. And the reason is it's such a slow-growing organism, and most antibiotics only work when the organism's replicating. So if it's not replicating, it doesn't really do anything. So you can imagine with Lyme why this becomes a problem. If it's a slow-growing organism, even with antibiotic therapy, if it's not replicating fast enough, you're just not hitting the life cycle at the right time for the drug to be effective. Lyme is also the ultimate shapeshifter. I always equate it to like a slinky. I might be too old. You guys know what a slinky is? Okay. So the slinky, remember, you had the thing, you would pull it apart. It was like this, wire coil. You would flop it down your stairs and would walk down the stairs. Well, you can imagine that slinky. You can pull it out, and then you can pull it up into a tight ball. Lyme literally does the same thing. It can uncoil itself into this corkscrew-shaped organism, and it can ball itself up. The problem is when it goes into that ball, they call it a round body or a cyst form, it's kind of dormant. The immune system has a hard time recognizing it in that form, and therefore it kind of just stays in the body, and even with all the different treatments you do, sometimes it's very hard when it's in this form to treat it. So this ability to shapeshift allows it to evade the immune system, and that's just one of the many reasons that Lyme can become very persistent in our bodies. So I sort of break down Lyme into both acute and chronic symptoms. In reality, there's a lot of overlap, but I think to sort of keep it straight in your head, this is an easy way to think of it. So people who get acute Lyme disease, and I should qualify, I got acute Lyme disease myself in 2002. I was living in Connecticut. 3 weeks before I opened my own practice, I got bit by a tick. 105 fever, headache, joint pain, neuropathy, the whole gamut. So people who get acute Lyme disease are generally acutely ill. They look ill, they'll tell you they're ill. High fever, headache, neck stiffness, joint pain, low back pain. I mean, I felt like my bat was broken, and I never had a broken bone in my life. Muscle aches, this classic bullseye rash. They call it an erythema migrans rash. This is telltale for Lyme. If you see this, don't pass go, don't collect $200. You know it's Lyme. All the other things don't matter because there's no other organism that we know of that causes that stereotypical rash. You can get fatigue, chills, swollen lymph nodes, heart palpitations, short of breath, memory problems, and a thing called Bell's palsy where half your face starts to droop. All of those are associated with acute Lyme disease. This is just a picture of that erythema migrans rash. Again, when you see these concentric, dark, clear, that's that erythema migrans rash. This gets confused a lot for mosquito bites sometimes, where you'll get a histamine reaction, which is just a central like red and then it gets clear. That's not the same as a bullseye rash. The one thing about this rash that's a little unusual too is it's flat. If you rub your hands over it, it does not raise. When you get a mosquito bite or other insect bite, usually it's a little bit swollen and raised. So that's one of the ways you can tell. Plus, mosquito bites tend to be very itchy. These bites tend not to be itchy. There's actually an anesthetic in the saliva of the tick that numbs it, so you won't feel the tick bite, and often you won't get that itch, at least not for several days. There are also other Lyme rashes that don't look anything like this. Again, if you go on Google, look up Lyme rashes, you'll see sometimes just these flat red rashes. Again, I think the difference is that they spread. Unlike other rashes that kind of get to a certain point and stop, these rashes will spread over the course of days to weeks. I think when I got infected, mine actually took almost 2 months before it stopped spreading. It started about the size of a quarter and got to about 13 centimeters by the time it was done. So acute symptoms typically occur 3 to 30 days after the tick bite. The CDC says that about 70% of the people get that erythema migrans rash. If you look at the research, it shows it's probably 40% or less. I'd say in my practice, maybe 20% have that rash. So if you see it, again, it's pretty much a slam dunk, but absent of that rash doesn't exclude the possibility of Lyme. And again, as I mentioned, Lyme symptoms are very vague. They look like a lot of other conditions, so misdiagnosis is common. And again, particularly if you live in a state where Lyme is not known to be endemic, and the doctor will just say, oh no, you got the flu, you got Epstein-Barr, you got fibromyalgia, you got chronic fatigue, you got 1,000 other diagnoses, and sometimes it takes a lot of digging before you find that it's actually related to Lyme. Now, conversely, I know how it is in the Lyme world. When you're a hammer, everything looks like a nail. So it's not always Lyme either. Sometimes it is other things. So Lyme is also a diagnosis of exclusion. As a doctor, we have to do our diligence to exclude other autoimmune diseases, other infections, and so forth. So it's, you got to rule in and rule out both possibilities. In chronic Lyme, it starts to look a little bit different. Again, you'll see a lot of overlap in symptoms, but I think one of the big things we see as it becomes more persistent is we see more neurological involvement, more neurological symptoms. So memory loss and cognitive impairment, more neuropathy, that's numbness, tingling of anywhere in your body, mostly the extremities. I think the strangest case I ever had of Lyme, I had a woman who came in, her only symptom is she had a spot on her cheek about the size of a quarter that was numb, and that was it. It was just annoying. It didn't bother her. It was just, kind of there. And I said, well, we live in Connecticut. Why don't we test you for Lyme? She tested positive for Lyme. I said, okay. We treated her, and the numbness completely went away. And that was her only symptom. So sometimes they're that easy. More often than not, they're not. They're usually much more problematic. But that sort of sensory distortion, people will also describe about burning sensations. They feel like they have a third-degree sunburn. You look at the skin, looks perfectly normal. People have this sensation of crawling bugs under their skin. All these weird, unexplained sensory issues are a type of neuropathy and often are related to Lyme. The other thing that's very telltale to Lyme is what we call wandering joint pain, which means one day my right shoulder hurts, then it's my left knee, then it's my right ankle, and every day it just kind of seems to move and migrate. There's nothing else that we know of that causes that. When you have other autoimmune diseases like rheumatoid arthritis or lupus, it's the same joint all the time, always swollen. It doesn't migrate that way. But that migratory joint pain is very symptomatic of Lyme. Light sensitivity, sound sensitivity, dizziness, sleep problems, rheumatism, that's just the old name for like joints, ache, muscle ache. You can get a thing called Lyme carditis, so when people start explaining of acute heart problems, we send them off to the cardiologist to rule that out. Fortunately, it's a very unusual consequence of Lyme, but it can happen. Newly acquired dyslexia. People will start complaining that they start transposing their letters, their numbers, their handwriting all of a sudden becomes really sloppy and they had nice penmanship before. These relatively sudden changes and those type of things, again, can be a sign of Lyme. And then we'll also see endocrine disruption. Hypothyroidism or low thyroid function is very common after having been exposed to Lyme. But you can see it, for women who with their menstrual cycle, they start getting their periods are off and they start getting adrenal issues and so forth. So as I mentioned, Lyme's the great imitator. It looks like a lot of stuff. This is a very short list. I used to have a slide set that had everything. I think it was 13 slides of all the things that have been associated with Lyme. So we just consolidated kind of some of the big ones. Autism is, of course, one that gets overlapped a lot. I'd say in my population and having talked to other doctors that are working with a lot of kids with autism, we've kind of come to a consensus. It's about 30%. I think of our kids, 30 to 40% of the kids that we test will test positive for Lyme who also have autism. Now, in treating the Lyme, their autism doesn't go away. But a lot of things that we thought were related to autism will go away. So I see toe walkers stop toe walking. I've seen, cognitive improvement. I've seen a lot of the behavior problems improve. So a lot of things, speech, yeah. So a lot of these things, that we think are just, it's just autism, we find out is actually related to the impact of what Lyme has done to their body. So by treating them, we get them healthier, and then we can really start to tease out what's really now still related to autism. MS is an extremely common misdiagnosis with Lyme. I know this from personal experience. My Lyme turned into MS, so I know it happens. And the lesions you see on an MRI with Lyme look identical to MS. I'm actually speaking at Terry Wall's conference this summer on MS about this very topic because I think it gets overlooked a lot. You got a lot of these diagnoses out there like MS and fibromyalgia that are just descriptions. They don't tell you anything about the cause. And there's some good evidence in the literature that Lyme is a cause, not the only cause, but a cause of MS. And I've seen a lot of patients with MS test positive for Lyme. We treat their Lyme and all of a sudden their MS goes away. So. Lou Gehrig's disease, there's a really great story. I have a colleague who was an oncologist in Colorado who was diagnosed with Lou Gehrig's disease, and you guys know it doesn't generally have a very good outcome. And he was in hospice. He had about 6 months to live. And a friend of his said, hey, did you ever get tested for Lyme? No, I live in Colorado. There's no Lyme there. Ha-ha. And he did a test and it was completely negative, nothing at all. And he said, well, look, you got nothing to lose. Why don't you try some IV antibiotics and see if it helps? So he did. And he kept testing himself along the way. I think he told me it was his 6th test before he tested positive. His immune system was so shot that he couldn't elicit an antibody response, so all these tests kept coming back negative. But once they started treating him, they stirred up the pot enough that he got an antibody response. He completely recovered from ALS, went back to work, had a Lyme clinic, and I heard he retired last year at the age of like 80. So it's a great story. His name's David Martz. It's a public thing. If you want to look up his information, M-A-R-T-Z. I think it's a great story, but I think it's also a great reminder how a lot of these neurological things like Alzheimer's and Parkinson's and MS, where we don't really understand what's going on underneath that Lyme or some of these co-infections could be triggers. Epstein-Barr, other herpes viruses, RA, lupus, all the autoimmune diseases, all these neurological diseases, all these can be a manifestation of Lyme. There's also a lot of other infections you can get through these tick bites. You know, we talk about Lyme, but every time I go to a Lyme conference, I swear there's like 10 more things that we find out ticks can spread. So from a diagnostic standpoint, when we're testing people for Lyme, we're often testing for numerous other organisms that can cause clinical symptoms that are almost identical. It's very hard sometimes to say, oh yeah, that's Lyme. You know, it could be Bartonella, it could be Babesia, Anaplasma. I gave you kind of a relatively short list of things we know are transmitted through these ticks, but in reality, clinically, it can be very difficult to distinguish one from the other. There are some characteristics of some of these co-infections that are more common to them that we don't necessarily see in Lyme. Like in Babesia, we'll get cyclical fever. It's a cousin of malaria, so it has kind of malaria-ish kind of symptoms. We'll get this thing called air hunger, where people feel like they just need to get a deep breath and they can't. Bartonella, you'll get these striae. If you ever see these look like stretch marks, particularly on the back, for people that haven't lost weight or gained weight, that's a telltale sign of Bartonella. So again, we got these few other clues that might suggest a co-infection, but again, we know in New England, up to 33% or more of the ticks that carry Lyme also carry something else, so it's actually common. So why are we seeing so much Lyme in the world? Well, in a nutshell, it's climate change. You know, this warmer temperatures means ticks don't get killed off in the winter. They have a longer replication breeding cycle. There's more ticks. Plus, a lot of the natural predators, possums actually tend to be one of them, are starting to die off. So if we don't get, if we get rid of the natural predator and we've got the climate change, the tick population keeps exploding. And I didn't put it in the slide set, but there's some research out of Canada showing that birds are what are taking these ticks out of their habitat into other areas of the world. And they've shown that these birds can take the ticks up, like past the Yukon in Canada, like long distances. So again, for people who say, well, there's no Lyme in our area, well, remember, birds can fly a long way, and they can carry these ticks a long way. So they then start a new population in those areas. And if you look at a map from maybe the late 90s to currently, you can see how that tick population really kind of pushed in from New England. It's now down the entire eastern seaboard, Florida, Georgia. These are all emerging states of Lyme disease. The whole West Coast is covered, and it just keeps pushing inward. So diagnosis of Lyme is controversial, and we could probably have a 2-day dissertation on Lyme diagnoses, so I'll give you the cliff notes. Basically, it sucks. And if you get a negative Lyme test, it doesn't exclude the possibility of having Lyme, and I'll explain a little bit why. So if you go to the CDC's website and you actually look at what they say, Lyme is a clinical diagnosis. And what that means is that it's based on your symptoms. We use the piece of paper to kind of prove our suspicion, but in reality, it's based on your collection of symptoms, knowing that Lyme testing isn't that great. So the CDC developed this test more than 40 years ago. They took the people who had known Lyme disease, drew their blood, looked to see what antibodies are there. They said, okay, well, if you have Lyme, you probably have these antibodies. Again, in 40 years of research, we have never changed the test, and we have never changed the criteria. It's archaic. I was a microbiologist before I was a doctor. I used to do this test for a living, and we used to laugh in the lab about what a horrible test it was. So it hasn't changed since. Plus, current Lyme testing really doesn't reflect the autoimmune problem that Lyme can trigger. We've got good evidence in the medical literature that after you have that initial exposure to Lyme, the longer it's in your body, it can really start triggering autoimmune problems. And not autoimmunity in the way we think of lupus and rheumatoid arthritis. And all those blood markers you test for autoimmunity are inevitably negative across the board. Unfortunately, we don't have a commercial test that's looking at these kind of autoimmune syndromes, but we know it exists. And I think that's why we see a lot of these neurological symptoms. There's a specific protein in the brain that it targets, and in the event of trying to go after the organism, it accidentally starts cross-reacting with our brain and our neurological tissue. So the way the CDC has it set out, it's a two-tier testing, which means the first test is a Lyme screen, and it's an IgG, IgM antibody test, and it's just kind of a yay or nay, positive or negative. If that test is positive, it flexes over to what's called the Western blot, which is a more specific antibody test, and now they test for a series of antibodies. They still do IgG and IgM. Now, doctors are taught in medical school that IgM means it's an acute antibody, your exposure was recent, IgG means it's an old infection. Partially true. In reality, Lyme, you can come in and out of being IgG and IgM positive. When I was first in practice, we used to test people pretty regularly, and it's like a cat chasing its freaking tail, because they become in and out of IgG and IgM with no pattern to it, and it doesn't change treatment. Ultimately, you treat people, you don't treat pieces of paper, so it wasn't very helpful in guiding treatment. So I'm at a point now, once we've established you've had exposure, I never do Lyme testing again. I don't think there's any clinical benefit. It's a waste of money, and it doesn't change your treatment because you're still going to treat the person in front of you. But this is what the CDC still says. And on the Western blot, there's 10 antibodies they test for. You have to have 5 of the 10. And in the IgM, there's 3 antibodies. You have to have 2 of the 3. Well, what we know from the research is that some of these antibodies are very specific to Lyme. Some of them are not specific to Lyme. Well, if you have one Lyme-specific antibody, which means as far as we know, there's no other organism that causes that antibody to be triggered, isn't that important? I mean, in my mind, it's like being a little pregnant, right? I mean, you are or you aren't. So, I mean, having a little Lyme disease or a lot of Lyme disease, what difference does it make? We know you've had exposure. And keep in mind, too, that's all this test is telling you, is you've had exposure. It does not tell you you have Lyme disease. Because theoretically, if I get bit by a tick and my immune system does everything it's supposed to do, I might get rid of the infection before it ever becomes symptomatic. But I'm going to have evidence in my immune system I had exposure. So you have to look at what's on the piece of paper, what's in front of you, and you put 2 and 2 together. But again, 40 years of research, they've never changed the criteria. So a lot of the pitfalls of testing, again, some people just don't make antibodies. I mean, come on, how many of our kids have immune issues? Like all of them? Yeah. Oh, come on, raise your hand. You're 2. Yeah, they all do. So why would you expect someone who's got any element of immune dysfunction to have a normal antibody response? Right? That's why half these kids end up on IVIG at some point, because they just don't make antibodies the way they're supposed to. So when you're doing an antibody test, hello, that's kind of a problem. Also, to be considered positive, there's a threshold that the CDC has set. So when they do this test, they compare you to a control, and you have to be at least 60% of the intensity of the control. So what they're really measuring is quantity. So if you don't make a lot of antibody, then making a little antibody, again, even if you meet those criteria, doesn't matter. So what ends up happening is that, I mean, I use a lab that actually gives me the percentage, and I've seen that they're 58%, 59%, 58%. Well, they're not 60%, so they're called negative. Really, 2%? I could probably draw you an hour later and you might be a % different. So these are the kind of problems we run into in Lyme testing. Plus, most conventional reference labs aren't testing for the breadth of antibodies we know are Lyme-specific. They only test for some of them, so they might miss someone who's got these Lyme-specific bands. And it can take up to 6 weeks to make antibodies. So if someone's been acutely exposed, if you do the test too early, it'll come back negative. And the doctor says, oh, you don't have Lyme, it's negative. I'm like, or maybe you're just in that window that you haven't made enough antibody response yet. So sometimes you do have to test people serially to see if they do start seroconverting. There is another group out there called ILAZ, the International Lyme and Associated Disease Society. They have a different set of criteria where they actually base it more on clinical symptoms than the lab tests themselves. They've also developed a different interpretation of the Lyme testing. So there are certain labs out there that we use that will give you that criteria, which is not the CDC criteria. And so as practitioners and patients, we can get a better assessment about whether someone may have had exposure to Lyme. And again, you have to rule out all these other inflammatory and autoimmune illnesses because there is that overlap. So let's get into a little bit about treatment. So if you know or suspect that your child may have been exposed to Lyme, then I really like to start with diet. And diet's one of these things, as you know, it's just kind of a pain. And you try so many different things, and particularly for kids that are picky eaters. What I found after having tried a lot of different diets is what's called an alkaline diet. And an alkaline diet's been around for decades. This is not my invention. This has been around a long time. But the whole concept of an alkaline diet, it's really about changing your cellular pH. If you look at all of your outside barriers to the world, so your skin, your bladder, your stomach, for women the vaginal area, these parts of the body are very acidic to protect against outside invaders, but the rest of your body is really pretty much alkaline. So if we can start to shift your body in a more alkaline state, that allows the cells to function better, the enzymes to function better, and so forth. When I wrote my book, it was interesting. I was doing a lot of research, and I was shocked when I only could find 3 studies on an alkaline diet. That was it. I was blown away. I've seen all these books written by all these people, and there's like hardly any research. Of course, there's no money in an alkaline diet. Who cares? But if you look at the studies, we did find it does a lot of good things in terms of reducing inflammation, and I think that's really one of the key things. If we can reduce inflammation overall, that's huge. So pH is very tightly regulated in the blood. You're not going to see any change in blood pH. That's not helpful. But you can do either saliva test or urine testing to monitor pH, and that's a really easy way to find out if what you're doing is actually accomplishing what you want. So we do want to see pH above 7 overall. And so I tell people test 20 minutes after you eat. If you do first morning urine, it's always going to be slightly acidic because your urine's concentrated. But 20 minutes after you eat, if you're doing everything that you should, you'll find that the pH is more alkaline. So I know this is very hard to read. You've hopefully got the slide set. If you guys really want, I have a PDF, a 1-page PDF I'm happy to send you that has this broken out so you can actually read it. But I break it down really into 3 categories. And the first category is these are foods you can consume as much as you want. And the reason is these are foods that are all very alkaline forming. And what you're going to find is that it really includes most vegetables. Most vegetables tend to be very alkaline forming. There are a few nuts and seeds, there are a few fruits. So something like lemon, lemon itself is very acidic. When we talk about foods being alkaline or acidic, it's not the pH of the food, it's how the food breaks down in your body. And if a food breaks down more into sodium and potassium, it tends to be very alkaline. If it's breaking down more into sulfate and phosphorus, it tends to be more acidic. So if you really don't know about a food, you can always go online and look and see what it breaks down to, and then you can tell if it's acid forming or alkaline. Pretty straightforward. So there's a few nuts and seeds, some grains, some of the good oils, beverages like alkaline water, herbal tea, some of the green drinks, of course, water. The second category are foods that you can have a little bit, but not a lot. And these foods tend to either be neutral or slightly acid forming. And what you'll see on this list are mostly fruits and animal proteins like meats and eggs. There are some other grains like rice and oats. So this category, I say, well, it's not that you can't have it, but you really want to limit your intake to about 20% of your total dietary intake for a week. And so at least, I think if you kind of go back to our true paleo forefathers, this is probably how they ate. We did kill, we just didn't kill every day. So we were still eating a mostly plant-based diet, but we did have some animal protein intermixed. And then this last category these are foods I would just flat out avoid. They're very acid forming in the body. Something like dairy products. I mean, come on, at this point, if your kids are on dairy, really, I think we got enough evidence that that's probably not a good thing. You'll see it's all junk food, processed food, refined food, the garbage oils like corn oil, cottonseed oil, soybean oil, alcohol. Gosh, I hope your kids aren't having too much alcohol. Black tea, coffee. Although I will say this. I have had some kids that they take a teaspoon or 2 of coffee and it just helps their behavior tremendously. So a little coffee may be okay if you have a kid who needs, instead of putting them on Ritalin, they might benefit from a little bit of caffeine. In that case, I'm kind of okay with it, but otherwise coffee is very acid forming. And of course, all fruit juices are very acid forming. So beyond diet, we start getting into other types of treatments to go after the active infection. I am not a proponent of antibiotic therapy for a lot of reasons. I think for someone who's got acute Lyme disease, antibiotics are very appropriate. Antibiotics long-term, for a lot of reasons, just don't tend to work out very well. The research is pretty clear that there's very limited benefit with antibiotics once you get into chronic stages. Not to mention that most antibiotics damage your mitochondria. Well, again, how many of these kids already have mito issues? You're just now going to compound that problem with long-term antibiotics. And Lyme itself can also damage the mitochondria. Plus, you're wiping out all your normal microbiome, your gut flora. And in my population, we work so hard to get these kids' guts working well. It just kind of stinks to have to undermine all of that great work for these antibiotics that aren't likely to do a lot of good anyway. So what I like is that herbs work really well. I think they're very effective at eradicating or treating Lyme, and they have minimal impact on the microbiome. Plus, herbs have more than one activity. When you give an antibiotic job is to kill. Herbs are anti-inflammatory, they help promote circulation, they've got a lot of other different effects that you just don't get with antibiotics. So I'll cover a couple of the different the herbal protocols that I use. This first one is from Dr. Lee Cowden, and you may have heard of the Cowden protocol. His protocol is set up that every month you kind of do a different series of tinctures. They're all liquids. And so the goal is that by constantly changing the protocol, you're sort of never letting the organism catch up and you never develop resistance. Fortunately, resistance to herbs, so far, I haven't really seen. I don't think the herbs or the organism's gotten clever enough yet to become sensitive to the herbs yet. So I like these because they're tinctures. You can do drop doses. Again, if your kid's really hypersensitive, has histamine issues, I like to be able to start very slowly and increase as tolerated. Always establish tolerance first, and then you can increase the dose as needed. The worst thing you do is go in with a sledgehammer, blow these kids out of the water, and then you're just left with a mess. So I bolded the ones out of all the different formulas he has. This is the 4 I generally start with. I actually don't change every month. I find it's complex, it's expensive, it's difficult, and it's really not necessary. There's a researcher at the University of New Haven, Dr. Eva Shoppe, who's actually studied those top 3 herbs that I highlighted, and she actually found they were more effective, at least in vitro, than antibiotics. So we know they clinically work, and again, minimal impact on the microbiome. So I like these herbs because, again, they help kill the bugs, they help support detoxification, can help clear out heavy metals. Again, I don't really follow the 5-month protocol as Dr. Cowden lays it out, but again, I like the fact they're liquids because they're really easy to administer to children, and they actually don't taste bad. So for kids who are very taste and texture oriented, you can mix these in a little bit of water juice, and they actually taste pretty good. So this is just the dosing schedule for acute Lyme disease. I really won't spend a lot of time on the dosing schedule. I just wanted you to have it for your own slide set in case you want to do it at home. Basically, with acute Lyme disease, I go in at higher doses because you really want to kind of hit it hard early on. As we move into persistent Lyme disease, we start very small. Start with 1 drop a day of each, and you can kind of increase every couple of days as the kids tolerate it. One of the things that can happen with Lyme treatment, you can get what's called a Herxheimer reaction. It's a die-off reaction. You might have experienced it with yeast. It's the same kind of problem. So there are ways to mitigate that through using the therapies, using the different herbs to help blunt that. So if kids start to get more hyperreactive while they're undergoing the therapy, instead of just having to back off the treatment, there are other things we can do to help quiet things down. So the advantages of this, it's really easy to administer, it's beneficial, pretty cost effective. The disadvantage is that you can get these die-off reactions. It does become a long-term treatment, although actually most Lyme treatments do end up being 6 to 12 months. That's pretty normal. It requires multiple bottles, so it's just a little bit labor intensive that you're counting all these drops. Fortunately, you can put them all in a glass of water and then just mix them up and have them drink it once, so it's not too difficult. Dr. Zhong is a doctor in New York City. He's a Chinese medical doctor, and he works as an acupuncturist in New York. He's who I personally saw after I had Lyme, and he treated me. And after having been on antibiotics for 9 months, he started treating me with Chinese herbs, and in 3 weeks I was 85% improved. So his therapy definitely helps. And I like it because in Chinese medicine, everything's put together as a formula. They don't really use herbs by themselves. So the formulas are all put together in a very synergistic way that they complement each other. So Herx reactions with his protocol is very, very uncommon. I like his protocol more than probably most other herbal protocols because I've seen probably the best clinical effectiveness with his protocol. The problem is they're capsules, so if your kids can't swallow capsules, this is pretty much impossible. The herbs are really bitter. You would never want to break open the capsules and just have them drink it because they're pretty nasty tasting. But for kids who can swallow capsules, it can be very, very effective. It also, I think, has cast the widest net of what Lyme does to the body. So again, it kills the bug, reduces inflammation, improves circulation, improves detoxification. So you're really getting a lot of bang for the buck with his protocol. So that's the dosing schedule for acute Lyme, dosing schedule for persistent. The herbal protocols just change a little bit depending on the symptoms, but a lot of the core formulas involve Artemisia and an herb called Hatunia. Those are pretty much in both. So the advantages, again, I think it's one of the more beneficial protocols out there. Herxing is uncommon and there's very few side effects. It's actually very well tolerated. The disadvantages, again, it's just a lot of capsules through the day. It's a long-term treatment. And honestly, out of all the herbal protocols, it's probably one of the most expensive. So what I tell people, I'm like, look, if money is no object, because it runs anywhere from $500 to $600 a month, exactly. So if that's possible, that's great. And if it's not, the Dr. Cowden stuff is a quarter of that price. There's also a protocol from Byron White. Byron White is an herbalist. His is not really a protocol. He's got a series of tinctures that you kind of have to know what you're treating. So there's a tincture for Lyme, there's a tincture for Babesia, there's a tincture for Bartonella. They're very potent, they're very effective. You'll find 1 or 2 drops sometimes will trigger herxing. So it's not my first line therapy just because a lot of people do get die-off. They are expensive. Each bottle is like $90 to $100, and you'll start to run through that fairly quickly. But it's an option. And what I tell people when they're starting Lyme treatment, it's like, look, start somewhere, whatever that protocol is, and if you get 2 months into it and you're not seeing any clinical improvement, time to change. Don't keep staying on a therapy waiting for it to magically happen. If it's not happening at 2 months, you're barking up the wrong tree, you need to shift. So again, the advantage of this is that sometimes now you're just dealing with single tinctures if it's just Lyme, maybe 1 or 2 if you've got co-infection. Disadvantages really is just that there's a lot of herxing that's pretty common, and the bottles themselves tend to be kind of expensive. There's other herbal protocols out there. Stephen Buhner, who's an herbalist, he wrote 2 books on Lyme disease and co-infection. Beyond Balance, Susan McCamish, a naturopath, has a series of formulas. Again, they're all very potent. So there's a lot of other herbs, and if you look fundamentally at what these herbs are doing, again, they're kind of the same with having antimicrobial effects, anti-inflammatory, and so forth. So sometimes you can mix and match depending on what works. My feeling is you really have to just individualize it to the person, find out what combination works best for them. But again, my expectation is that it's moving people forward, not necessarily moving people backwards. A little herxing's okay if it's temporary. When people tell me that, gosh, they've been herxing for a month, you're barking up the wrong tree and you need to stop the treatment or cut the dose back. Biofilm becomes very important in Lyme disease. If you guys have ever listened to Dr. Usman talk, she talks a lot about biofilm, particularly gut biofilms. Well, Lyme happens to be particularly good at making biofilm. So we want to do something to help break the biofilm down so it's easier for our treatment to actually get to the root of the problem, start killing that bacteria. So using some sort of biofilm busting enzyme. There's a lot of different products out there. Dr. Usman has a product that she developed specifically I like a lot to help break down biofilm. Things like serrapeptase, nattokinase, lumbrokinase. These particular enzymes are very effective at breaking down biofilm. There's a product called Interphase Plus that has these enzymes plus a little bit of EDTA. This is not EDTA as a chelator. This is EDTA as a compound to break down biofilm. With any of these biofilm busters, though, it's really important that you take it away from food. You don't want to take it with food. Otherwise, it just digests your food, and you want it to get absorbed into your bloodstream and start breaking that biofilm down in your blood. Coconut oil is a great natural biofilm buster. I just tell people just incorporate coconut oil into your diet without necessarily having to go crazy with it. And N-acetylcysteine is also very effective. We like NAC a lot too because it's a precursor to glutathione. And again, most of our kids tend to be deficient in glutathione. I know Pharmanac was popular for a while. I think the product's still out there. If you're going to use NAC long-term, just be aware it does deplete zinc. And zinc deficiency is also not uncommon in our kids. So just check their zinc levels periodically or supplement them with a little bit of zinc because it is something that often does get deficient in the diet. Lotus Immunotherapy, I've given a talk for TACA before on LDI. I think you can get the recording through TACA, maybe? Yes, Janine's saying yes. So if you want to learn more about this, it's a great therapy. It's a way of helping turn off that autoimmune reaction that Lyme has triggered. And again, for anyone who's had persistent Lyme, this is a very common consequence of having had Lyme. So Ty Vincent's a medical doctor in Hawaii, and if you had a chance to hear him speak, he's very outgoing and dynamic. And so opinionated, I should say, too. But he's a feeling that you don't need any antimicrobial treatment, just use LDI and it cures everything. But it does help a lot of people. And I think it's one of the few therapies out there I found that can really start helping turning off these autoimmune reactions. So we know what happens with Lyme. Any other condition you guys know of where autoimmunity is kind of a problem? Makes kids crazy? PANS, right? I found this to be extremely effective for PANS. So, and the thing with PANS is that strep is usually not the problem. At least in my population. I have found that Lyme will help more kids than strep does when I give them with LDI. So I found there's about 5 antigens with LDI that come up over and over: strep, Lyme, mycoplasma, candida, and clostridia. over and over and over and over. So between those 5 antigens, even if you did no testing, there's a good chance you would catch one of them. So it's this concept of molecular mimicry that triggers that. There's something in the molecule of the organism that's similar to our own tissue. As our immune system's trying to react to that, it accidentally starts affecting our own tissue, in many cases the brain, the nervous system, and that's why you start getting the behavior problems, the sleep problems, the headaches, the neuropathy, all these various kinds of symptoms. When you hit LDI right, when you get it right on the nose, you will see a change often within 24 to 48 hours. So the good news about this therapy is that it doesn't take months and months to figure out if it's helping or not. Now, finding the right dose sometimes does take some time. That's the challenge. But when you find the right antigen, right dose, the reaction to it's actually very, very quick. So the goal of LDI is really to help promote tolerance to whatever that offending antigen is. And LDI is basically dead bug. It's been irradiated, so it can't replicate, it can't cause infection. We dilute it out millions to trillions of times, and we mix it with an enzyme called beta-glucuronidase. And we know that the beta-glucuronidase can help turn off whatever it's mixed with. So if it's mixed with Lyme, strep, candida, whatever the antigen is. But this enzyme is really the driver of what allows that immune system to start to shift. So the antigen selected is really based on what we, the practitioner, think is the biggest trigger. Sue Suedo kind of said, when she was talking about PANS, that, testing's worthless. And we all doctors kind of sat with our jaws hitting the ground like, what? She's like, nope, she goes, just treat people. Well, we still like to do testing. And I think from an LDI standpoint, it's good to know because it gives us an idea of what target we need to hit. So if it's strep, if we see high ASO titers in the blood, we see a lot of Clostridia on your OAT test, we see a lot of Klebsiella on your stool test, at least gives us a place that we can start looking for these different antigens. So once you find the right dose, they get a dose every 7 to 8 weeks. It's literally 2 drops that go under the tongue. It's very simple. It tastes like water. So very easy to administer. Again, the challenge of this therapy is really just to find what is the right antigen, what is the right dose. It may take sometimes a few months to sort that out. And if you can hang in there with it, usually we have success. I'll just mention PMF. PMF is pulsed electromagnetic frequencies. This is a device that basically generates a signal that resonates with your own cells. And the Germans have done a ton of research on this and just shows it helps with cellular repair and circulation. So again, I like it. It's a non-invasive, safe therapy that's got some science behind it. There are home devices, there's professional devices. Kids actually tend to like it if you can get them to lay down on a mat, because that's typically what it is. We have one in our office we use, and people find it very relaxing. It's sort of almost like a neurofeedback. It's completely different than neurofeedback, but the feeling you get afterwards is just that calming sensation. And so it might be something worth looking into for your own kids. So benefits of it: improved circulation, decreased pain, reduced inflammation, faster recovery after injury, heals skin wounds, and accelerates nerve regeneration. This is all based on the research. Just a quick thing about low-dose naltrexone. I'm a naturopath. I'm supposed to tell you drugs are bad. I can tell you I like low-dose naltrexone and use a lot of it. At low doses, this medicine was originally designed to help get people off drug and alcohol addiction, but at low doses, it actually has an immune-modulating effect. We've got over 40 studies on low-dose naltrexone for various different things used off-label. They've done at least one study in autism that was beneficial, MS, fibromyalgia, cancer. Again, it's a very safe medication. It's a very cheap medication. I think 3 months is only $40. So I figure for the cost and the benefit, it's definitely worth trying. Again, I think for a lot of kids that have immune dysfunction, particularly if it's triggered by Lyme or a co-infection, this is, again, a way in conjunction with everything else to help modulate the immune system, and it's certainly very safe. Really, the only side effect is that some people will get wild, vivid dreams, and other people do complain that their sleep gets a little disrupted. Usually if we start small doses and work our way up, that doesn't happen, but that's pretty much the worst thing that could happen. Here's just some of the research on LDN if you want to look it up. Dosing for children, we typically start at either 0.5 to 1 milligram at bedtime, and then we can increase up to 3 milligrams really as needed. So just to sort of wrap things up, we want to treat the organism if it's acute, treat these immune distractors. You have to look at other allergies that distract the immune system, like food allergies, environmental allergies. Work on detoxification. If there's any kind of endocrine disruption, we want to fix that. Make sure kids are getting proper sleep, reduce inflammation, make sure their nutrition's good, help improve their mitochondrial function, get their circulation going, reduce autoimmunity. And I wrote a book, and we're going to do a book signing after this if anyone's interested. And that's my information if you need it, so we'll take questions. Great, thank you. Ooh, this is a loaded question, I love it. Do you consider DNA connections test more reliable versus IGeneX? Is the DNA connections test that shows NPS, that's non-predicted size positive for Lyme? So being a former microbiologist, I am not a fan of DNA connections. I have issues with a lot of DNA technology. And the problem with DNA technology, and without getting too complex, is that there's these things called primers. Primers are what you use to help tell you whenever because what you're doing is you're taking a small fragment of DNA, you have to amplify it to be able to tell what it is. It's kind of like, if you're building a house, if you're off 1 inch in one corner, you go to the other side of the house, now you're going to be off a foot, right? It's just how things change. The same thing happens with DNA technology. If you're off a little at the beginning, you're going to be off a lot at the end. So the end product can sometimes be erroneous. And as far as I know, DNA Connections doesn't use validated primers, so I don't know what they're getting. And I have had DNA Connections run in collaboration with other tests, and they don't match. So I'm a little hesitant to jump in with DNA Connections. What is your level of confidence in lab testing for co-infections, Babesia, and so forth? Same as Borrelia. I think the co-infections don't have the same issues we see with Lyme. Lyme tends to be a bit more elusive than some of the co-infections. So by and large, I have not had the same kind of issues with co-infections. So I still use a lab called MDL out of New Jersey. I think their co-infection testing is better than Quest or LabCorp, the regular labs out there. MDL I like too because they bill insurance. So IGeneX is a great lab. I love them. It's just they're out of pocket unless you're Medicare. And $1,600, $1,800 to do a full Lyme and co-infection panel gets to be a bit steep, where MDL will bill your insurance and it doesn't cost you a dime. What do you like to use if you suspect the Borrelia has gone into cyst form? Biofilm Busters, herbals. Yeah, so fortunately the herbs that I just mentioned will deal with Lyme in both its uncoiled form and the cyst form, so it doesn't really change. And yeah, you want to use Biofilm Busters to help break those cysts up. If a child has a history of mold exposure in Lyme, does that completely change the medications? Yes, and I'm going to talk about mold Sunday morning, so we're going to cover that if you're interested. So yes, it does change. If mold and Lyme are probably the two things that look clinically similar. So if we started someone on Lyme treatment and they're not really getting a lot better, mold is the next thing we look at. I'm at a point now where I just start testing both right off the bat so we save time. More questions? If diagnosed with Lyme, Epstein-Barr, and Crohn's disease from labs, what would be one supplement above others that would be better than the rest to support immune system? Please name your top 4 herbs. Oh, well, that's a bit specific. You know what? Come see me afterwards who wrote this, and I'll talk to you personally. My son has pandas, autism, and seizures. How do you test for Lyme? When he has an IVIG every 4 weeks. And how do you treat if he's allergic to penicillin? Well, if the testing for Lyme, again, I do a combination of MDL, which is a blood test, for Lyme and co-infections. I also use a lab called Global Lyme Diagnostics. I'm actually on their scientific advisory board. They test for all the different strains of Borrelia, so I like the fact that we can look at all the different strains and not just Borrelia burgdorferi. So I'll run both those labs in parallel. And so that way I cover Lyme, all the different strains of Borrelia, and all the co-infections. So that's going to give me most information from that standpoint. If they're already on IVIG, depending on what the problem was before they started IVIG, I like to do the testing away from the IVIG. So typically if you're on a 4-week or 6-week cycle, I'll have you do the blood work right before you're due for your next cycle. So at least sort of the effect of the IVIG is worn off a little bit. That seems to give us better results. And how do you treat if allergic to penicillin? Well, we don't give penicillin, so that's not a problem. Would you ban having a dog because possibility of getting ticks and Lyme? Look, if you've got dogs, you got to be very careful. I got my Lyme from my dog. So if you have a dog and your dog's out romping around, dogs get ticks, and they can bring the ticks in the home. I had a little Maltese, white, fluffy dog, and my ex-wife insisted sleep in the bed with us, so I'm sure that's where I got it. And so just be aware, if you've got dogs that are outdoors and they spend a lot of up-close personal time, which most pets do, checking dogs for ticks is like looking for a needle in a stack of needles. It's really, really hard. So I think you have to be careful. There are some natural sprays that you can do for your kids and your pets to protect them when they are outdoors to try and limit it. Try and do tick checks anyway. depending on the fur of specifically dogs, the ones that have a little bit thicker fur where it's going to take a while for the tick to burrow inside, you at least might have a chance when they first come in of getting it on the outside before they have a chance to get deeper. Keep looking, but it's a problem, and I don't know if I've got a good way around it. I mean, if you're a pet person, I would certainly not say, oh yeah, don't ever have a pet because you're going to get Lyme. I mean, that's stupid. So just be diligent, be careful, and check your pets as well as you check your kids, because they are your kids, right? Yeah. Most kids with pandas have Lyme. I think some kids with pandas have Lyme. I've definitely seen more effect when I use the Lyme LDI than the strep LDI, so it is a common cause of pandas, again, not the only one. Someone is asking about the Lyme disease Western blot, the band 41. Band 41 is a very common band. 80% of the population has it. That 41 band is a flagellar protein. Flagellars are little tails that bacteria have. A lot of bacteria have flagella that aren't Lyme. So you'll see 41 in just about everyone. So when we see 41 by itself, we don't get really that excited. Lyme antibody IgM by Western blot. IgM antibody present. I'm sorry, I'm not quite sure what that's asking. I mean, if I see IgM antibodies, so the antibodies that are very specific to Lyme is 23, 34, 39, and 93. And if you use IGNX, 31 is also unique to Lyme. 31 on everyone else's test can cross-react with Epstein-Barr. But IGNX has developed their test in a different way that they eliminated that protein that cross-reacts with Epstein-Barr. So their specific test, 31, is specific to Lyme. So 23, 34, 39, 93. In my world, if I see even one of those antibodies, IgG or IgM, and they're symptomatic, and we've ruled everything out, we treat. How would you rank detox treatments and agents for a person exposed to toxic mold and has tested positive for Lyme and many co-infections? I think detox is extremely important for both situations. Lyme itself creates its own set of toxicity as well as mold and mycotoxins. I do not personally use cholestyramine. I know that's Richie Shoemaker's baby. I don't agree with it at all. It causes a lot of problems with fat malabsorption, or it interferes with fat-soluble vitamins. It's gross. It's expensive. The commercial stuff has aspartame in it. You can get the unsweetened stuff from Hopticon drug, which is cheaper, but I find that activated charcoal, bentonite clay work beautifully in removing mycotoxins. And we've also been using, ion cleanse foot baths, sauna, colon hydrotherapy. There are other ways to mobilize mycotoxins. Glutathione is great. One more question. Okay, let's see. Let me find the best one. I think I already answered that one, actually. Oh, here's one. Ozone therapy and its effect on Lyme. Very powerful. I've been, ozone therapy, I'll say oxidative therapies overall for chronic infection. My personal experience, my professional experience, is it seems to be a short-lived benefit. I have not seen a lot of long-term benefit, and most practices that offer it, it's very expensive. So if you're doing IV ozone or ozone in the ear or wherever they're putting it, or any other type of the UV lights, it just tends to be fairly short-lived for the price. So I guess my feeling is if you can afford it and you have access, it's probably worth a try, but I have not seen it get rid of Lyme per se. I think the issue is if you got to that point where you've had Lyme for a long time, you're now in more of that autoimmune issue. Oxidative therapies aren't going to correct that autoimmunity. They're very effective at killing the bug, but at that point, that's not the problem. Now you got to figure out therapies that are going to modulate the immune system, and I have not seen ozone therapy to date do that. So on that note.